Welcome to Health Matters. You can call me Village Doctor. Today, I want to discuss with you issues and topics on breastfeeding. As we enter Breastfeeding Week, World Breastfeeding Week, I want us to share more light on information, education, myths, misconceptions, the facts about breastfeeding. I want us to throw more light on all issues involving breastfeeding. So stay with me. All what you have to do for me is to click on the plus button, like, comment, and share this video for others to also benefit from it. As we enter the week of breastfeeding, as the whole world is celebrating breastfeeding or celebrating mothers who breastfeed, and it gives us the opportunity to talk more about breastfeeding. I want us to today talk about the facts. Facts about breastfeeding. There are some facts that we have to establish, or they are already established, and we have to know them about breastfeeding. Number one is nutrition. We are saying that breast milk provides the optimal nutrition that a child needs. When a child is born, all the nutrition that the child needs is provided in the breast milk. The child is supposed to feed on the breast milk and breast milk alone. So, in God's own wisdom, the breast milk is very nutritious. It's made to be nutritious enough for the child. It contains carbohydrates, fats, minerals, and vitamins. So, these are the facts, or one of the facts about breast milk. Breast milk is the optimal, is the best nutrition for babies. And it's a perfect mixture, a well balanced concentrates or fluid made up of protein, made up of minerals, made up of fat, made up of carbohydrates. So what we are saying is like, instead of you eating all the food nutrient that you get from every kind of food that you are going to eat from, or you are going to feed the baby from, you will equally get it from the breast milk, being its protein, fats, carbohydrates, minerals, and vitamins. So this is one of the facts that we need to establish. Number two, the second fact is breast milk boosts immunity. Breast milk boosts immunity. So breast milk contain antibodies that can protect babies from infections and diseases. There are lots of antibodies that are found in the breast milk. So the only thing you have to do is feed your baby well with breast milk, and these antibodies that will fight against infection and diseases which are found in the breast milk will adequately protect the baby from these kind of infections and diseases. Most of the time, people tend to think that breast milk is not anything, but breast milk is enough to protect your baby. If you feed baby and feed the baby well with breast milk, it contains antibodies that will protect and fight against infections and diseases. Point number three, bonding. In the process of you breastfeeding the child, there is that kind of bonding that is created between you and the child, you, the mother, and the child. So it creates that kind of physical bonding. And this physical bonding comes as a result of the screen to screen contact. As let's say, if you are feeding this child for about 2 years, that period or that 2 year period that you are feeding the child, you have the skin to skin bonding. You are always with the child, looking into the face of the child whilst breastfeeding, and a whole lot of things. It creates physical bonding with the child. So it helps you to bond very well, and the child tends to know you, or the closeness between you and the child becomes very tight. So we call it physical bonding. And number four, brain development. Breastfeeding has been shown to enhance brain development and improve cognitive function. So with breast milk, it's when a child feeds and feeds well on breast milk, what we are saying is it helps in the brain development. You see, the brain needs nutrients to develop very well, especially at that tender age. So if you feed the child well with these nutrients, the protein which is found in the breast milk, the fat which is found in the breast milk, the vitamins, and all those nutrients which are rich in the breast milk. When we feed the child with these nutrients which are found in the breast milk, what we are saying is it helps in the brain development and the cognitive aspect functioning of the child. Point number 5. Breastfeeding provides a lot of health benefits for the mother. Breastfeeding provides a lot of health benefits for the mother. One, breastfeeding can help with postpartum weight loss and it can reduce the risk of breast and ovarian cancer and lower the risk of postpartum depression. So, postpartum weight loss, as the child is feeding, there's something we call postpartum weight loss after delivery. There's that kind of weight loss that some mothers, all of a sudden after delivery, they lose weight abnormally. We call it postpartum weight loss. So breastfeeding helps to reduce that. And two, it helps to reduce the risk of breast and ovarian cancer. So when the moment you give birth, naturally the body produces or there is production of breast milk, which makes your breast become so tender and tight, filled with breast milk. So if the child doesn't suck the breast out and the breast milk is found to stuck in the breast ducts. There is a duct that we call the duct and the tubes and the loops. There's possibility of you developing the tenderness, the pain and stuff, which has the consequence effect of you developing all these kind of cancers and tumors. So we are saying that to the mother, breastfeeding helps you. When the child sucks all the breast milk which is produced in the breast away. You feel okay, the tenderness, everything is reduced. The same thing applies to the ovarian cancer. You see, it's hormonal something. So as the child is breastfeeding, hormones are released to prepare the ovaries, prepare the womb, prepare the fallopian tube and everything. So it deals with prevention of every form of abnormality in the reproductive system of a woman. What you are saying is it lowers the risk of postpartum depression. There is a condition that I have a video on, we call it postpartum depression. All of a sudden, women, because of the spike and the changes in the hormones, some women tend to become depressed. All of a sudden, they become depressed, they become sad, they don't know what to do. Their life is turned upside down the moment they give birth. Let's say, and this happens within 4 or 5 days to about a week after delivery. Some tend to become so depressed that they don't want to even feed the child. They don't want to even bath. They don't want to even eat. They don't want to even take any drug. They feel sad for even giving birth. We call it postpartum depression. They become so depressed after delivery. And this is as a result of the spikes in the hormones during pregnancy and during the labor, during delivery. And the hormones should balance after delivery. So if the hormones are not able to balance to normal and there are spikes and changes, the parent or the mother tends to become depressed. And feeding the child very well also helps in the hormones becoming balanced. Feeding the child with the breast milk helps the normal, helps us to restore the hormones that went abnormally spiked or that were spiked abnormally to return to normality. So breastfeeding helps to reduce postpartum depression. This is how we can explain to the layman person that as you are breastfeeding, it helps you to restore your hormones that were changed during pregnancy, the hormone levels that were changed during the delivery, during the labor and stuff. As you are breastfeeding, it helps in the restoration of these hormones to their normal levels, thereby preventing you from getting any postpartum depression. Point number 6, breastfeeding and breast milk is convenient. One of the facts that we cannot do away with or cannot do away when it comes to breastfeeding is convenience. Breast milk is always available and at right temperature. So you know what? Breast milk is not something that you're not going to cook, going to ensure that it's the moment you try to breastfeed, breast milk is always available, and it makes you feel very convenient in breastfeeding. Breast milk is convenient, always available. You always have to just sit, prepare your mind, and breastfeed. So the conveniency is assured. Point number 7. I like this point too much. One of the facts about breastfeeding, and I'm saying that I'm so much interested about it, that's cost effective. Breast milk is free, unlike the formula foods, which can be expensive. So a lot of time, so many times, mothers give birth and they want to switch from breast milk to a lot of formula foods. No. One thing I want to assure is breast milk is very cost effective. You don't need to spend so much to give breast milk. Instead of, or rather than spending much money on getting formulas to feed a child, breast milk is very less expensive. In fact, it's not expensive at all. So one of the facts that we should know, if you should compare breast milk to any other feed that you will give to your child, please give breast milk, because breast milk is convenient and is cost effective. One of the most important factors to also consider, or to be a fact when it comes to breastfeeding, is it's a WHO recommendation. World Health Organization recommends that exclusive breastfeeding is done for 6 months, with continued breastfeeding along with solid foods up to 2 years or beyond. So when it comes to breastfeeding, it's a recommendation, something that World Health Organization recommends, that at least every mother or every child benefits from breast milk exclusively for 6 months, and also continue with solid food and other complementary feeding for at least 2 years or beyond. So what they are saying is, it's a recommendation. It's one of the criteria, one of the things that is very needed to help the child develop. It's a fact that a child needs breast milk. So breast milk is a recommendation from the WHO. So it's not something that somebody has created. From the World Health Organization, they recommend that we breastfeed and breastfeed well. And they are even talking about exclusive breastfeeding. That's feeding the child only with breast milk for 6 months. Then start adding solid or any form of complementary feeding after 6 months to 2, 3 years or beyond. The last point I want to talk about is having support when breastfeeding. One of the facts that you have to establish is every breastfeeding mother needs support. So having a supportive partner, a family member, or a healthcare team that can help you, or that can help you ensure that you breastfeed and breastfeed well, will make a big difference. So we need our entreat, or through this video, entreat all partners, all family members, all caretakers, all health workers or health teams to support any breastfeeding mother. If the person is your wife or your partner, or is your client as a health worker, or is your family member, the person needs support, because the journey of breastfeeding is not something to play with. It's something the person needs support. You need support to encourage the person, especially during the exclusive breastfeeding period. Encourage the person, support the person, to make sure that always remind the person or educate the person on the need to breastfeed exclusively, and on the need to add complementary food when the child turns 6 months and beyond. Thank you very much for joining me for this episode, talking about the important facts about breastfeeding. Stay tuned. This is Health Matters with me, Village Doctor. Don't forget to subscribe, like, comment this video, and share to others to help them to also learn from this video. Thank you very much.